Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care.
Hello, everyone, and welcome to another episode and the final episode of 2024 here at Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's episode, we have leading CalAIM facilitator, Dora Barilla, who rejoins the show after last appearing in 2023. In today's episode, Dora takes the time to recap the CalAIM initiative, why some people refer to it as Medi-Cal Transformation, and what's to come in 2025 and beyond. We hope you enjoyed today's episode. Feel free to check out other episodes of Pop Health Podcast by visiting us at pophealthpodcast.com, checking us out on our YouTube channel, or visiting us wherever you listen to your podcasts. Thanks, everybody. Enjoy today's episode. Dora, thanks so much for joining the show today.
Thank you, Gavin. I'm pleased to be here.
Yeah, great to have you back. Folks, I have to admit, I did a bad job asking Dora to be on this episode. I gave her a very short notice, and she was kind enough to make space for us and you guys as we record kind of at the beginning of the holiday season. So Dora, thank you so much. Thank you to Christine on your team for helping arrange this as well. So we always like to start our shows, folks, as you may know, or Dora knows, with the fun fact about our guest. So Dora, same as usual, tell us something about you that might surprise us or a fun fact.
Yeah, just a real quick fun fact, and I thought it was so pertinent, because of the fires that are happening right now. I did my undergraduate at Pepperdine University, and I did it in sports medicine. And when we're filming this, there's fires all around Pepperdine University in Malibu, and it was just a reminder. For me, I did sports medicine, and I wanted to, just make the world healthy by eating right and exercise. But I think just like the fires have shown us that it really, it's about building community, and that building community is really the core of my heart, and it's the core of this work. And, just prayers and go out to everyone at Pepperdine University, but it's a reminder that we all need to work together. We all need to not be polarized, and we need to come together as community all the time, but especially in those moments of crisis, because that's what it's going to take to build a solid infrastructure for all of us to thrive.
Yeah. Well, that's a lovely campus. It's right by the ocean, but still at risk of fires. And thanks for the mention of Pepperdine. I know there's at least one other person on your team who has a connection to Pepperdine. But it's a great school, folks. If you haven't heard of it, it is in the Malibu area of Los Angeles. And hopefully everyone is safe.
Yeah, our Dr. Angel Costin is the founding dean of the School of Nursing at Pepperdine as well. So she's one of our partners. Yeah.
That is awesome. Thanks for that.
Lots of fun facts about Pepperdine today.
Sorry?
I said lots of fun facts regarding Pepperdine today.
Yes. Well, hopefully we look back and everything is fun and everybody's good.
Yes.
So that is key. All right. Well, before we jump into recapping the CalAIM or Medi-Cal Transformation initiative for 2024 and what's coming up in 2025, the folks that are listening or watching today may not have seen our past episodes where you participated, Dora, and they may see on your screen HC² Strategies. Tell us how or who HC² is and why is HC² such a key player in the CalAIM or Medi-Cal Transformation Initiative.
Yeah, thank you, Gavin. So HC² Strategies stands for Healthy Connected Communities. And I'm a doctor of public health, and my co-founder, it was a CEO, CFO of large health systems. And what we really found was that the next frontier of transforming healthcare was really coming together as a community-based model. We felt that it was really the community was the key. And so we're a mission-driven consultancy firm that's really looking at transforming communities by building bridges with multiple sectors. So the healthcare field, community-based organizations and social services. And so we're a platform for change makers who want to do some transformation in communities to make everyone's lives better. And we started our firm in 2015, and it's been just an amazing journey of adding people to our platform who are values aligned and mission driven and really want to do that transformational change. And so we've been working with the managed care plans as well as the Department of Healthcare Services for the last 3 years in really looking at the opportunity with CalAIM, because we really saw this as a transformative policy to help build system and infrastructure. And so we have HC² Strategies is currently facilitating what we call collaborative planning and implementation. So it's really pulling communities together for the CalAIM initiative. So it's all of the providers, all of the health systems, all the social services to implement a lot of the enhanced care management and community support services. And we are currently in 24 counties across the state of California, as well as we facilitate the statewide Indian Health Collaborative. So we're just really excited to be partnering with facilitators around the state as well. There's 9 of us, and we're really working together to implement this transformative model.
Great. So when you say you're in 24 counties, you guys are hosting boots on the ground, collaborative, some virtual, but also some in person. And you've been selected by the state ultimately to lead the CalAIM initiative in those 24 counties through community-based providers and collaborations. Did I say that about right, or did I mix that up at all?
Yeah, so I think yes, we've been chosen. So there's 9 collaboratives, and so in 24 counties. But we've been, I like to say co-lead. So it's really facilitate the implementation, because it's not about us leading it, but it's about bringing in the community to lead it. So we're really about a community empowerment model. So bringing in community to help them lead it. So we like to view it as a facilitation model.
Well said, and sorry for the misspeaking on my part. But
That's okay. That's okay.
Thanks for the correction there. Okay, so you guys have started with the initiative since 2022. You've heard me say Medi-Cal Transformation and CalAIM, and I'm hearing through different individuals, they use the different terminology. Would you mind sharing why some folks might say CalAIM and some folks might say Medi-Cal Transformation?
Yeah, so CalAIM is really an evolution of whole person care in the Health Homes program. And so CalAIM is California Advancing and Innovating Medi-Cal. And I think there's really been a push to make this a movement that stays. So it's not just an initiative, that it's really about a larger transformation of Medi-Cal, a systems transformation. So I think that's the nuance, but whether you hear CalAIM or Medi-Cal Transformation, we're talking about the same thing, really improving the lives of California residents that need it the most.
Okay, awesome. Thank you for helping me clarify that. That's a selfish question because my team is often asking me, what is the difference, how that came together. So when I play this back, I'm going to actually write myself some notes so I can tell my team exactly what you said in a clear context.
Fair enough. You're not alone. You're not alone.
Yes, thank you. Okay, so one of the things I haven't asked, I don't think in past episodes, is a little bit about your team. So you guys are covering 24 counties through 9. So you have 9 collaboratives because some of those counties are combined, I'm guessing, for some of those collaboratives.
Yes.
Tell us about your team. How is it structured? Do you have leaders in each county? How does that work for HC²?
Yeah. So we have a pretty broad team, but we all work together. So, and actually this year we've been, for the past 2 years, we've been actually this year, and then going into next year, we partner with the Institute for Healthcare Improvement. So we came together because we were building off of each other's strengths, that they've done a lot of quality improvement and, health systems transformation work. And we've been really boots on the ground looking at doing a lot of that transformation in communities. And so our team is, pretty amazing. I'm just going to brag about my team for a minute because they really have been people that have been working in this for 30 years. This isn't something that, there's funding and there's resources now for doing, connecting social and clinical care. We have a team of dedicated, mission-driven leaders. And so how it works is We usually have a facilitator and a co-facilitator. So we have two facilitators in each one of our collaboratives, and then we have a project manager, and then we have our learning from across all of our collaboratives. So we all come together and learn from each other and scale best practices and look at what's working, and very quickly can iterate and pivot when there's a challenge, and troubleshoot to overcome that.
That's great. And I know whenever I've joined some of your collaboratives, you are asking about the challenges and what's needed. And then we have seen the pivots and the changes, which is pretty cool to see. And sometimes those are implemented. I know we joke around that government takes forever to change, but sometimes, there have been some pretty quick movements and turnarounds. And I've also interacted with DHS a little bit with some questions directly, and they've been available and answered. So it's been pretty cool to change my mindset.
Yeah, no, I mean, they're very committed to this, and we meet with them on a monthly basis. So Public Consulting Group is the third party administrator. So collecting data every month, what's working, what's not working, how can we collaborate and work together? And I agree, Gavin. I have never seen such commitment and flexibility and nimbleness to overcome some of the challenges, the implementation challenges from the state. They hear it, and they, have a thoughtful team and have made policy corrections.
That's great. So you guys have been doing this now for almost 3 years, being live. You probably were prepping before the CalAIM initiative went live, so maybe even longer. But in your 3 years, one of the things you mentioned is what's working, what's not working. So can you tell us, in the first 3 years, what would you say is working?
Yeah, so we've been, like you said, we've been doing this for most of our careers. Okay. But officially, with the state and with the CalAIM initiative or Medi-Cal Transformation, this cycle. But just I do want to point out, Gavin, that this work is important and needed regardless. There's the reason that you have the populations of focus for enhanced care management is because the state has identified these are the communities or the populations that aren't getting the quality of care that they need. They're, falling through the cracks. They're not having the transitions. They're not having the quality and, necessarily the equity across the board. So, so just that this isn't a blip, that this is really how we need to do work. This is the transformation that needs to happen. And so for the past 3 years, we've been working on, before what we call the collaboratives, we were working on roundtables with the managed care plans who were getting ready for the implementation, because the managed care plans are really the heart and soul of the contracting for all the providers. So, I think what has really been working is, what I'm really inspired by is the passion and commitment of the teams that want to make this work, and the providers willing to learn from each other and share some of their learnings. I mean, it's really been a very inspirational. So, I mean, in a sense, it's a lot of competitors coming together. So yeah. I think that has been that you've created this community of practice, and people are learning, and they're learning quickly, and they're, making modifications. I think the other thing is just this, I think what we've seen, in terms of some of the successes is that people are coming together, and a willingness to share data to develop systems of care. And I'm going to use that term a lot, versus siloed care. So it's system infrastructure, looking at integration, developing coordinating systems. The homeless response system is now partnering with the health system. And so, often what was happening is that someone that was experiencing homelessness or, other populations of focus are being bounced around, and no one's doing that cross-sector, integrating work. And so that's what we've really seen take hold in a lot of our counties.
Awesome. So, and I've seen that as well, with that being the individuals experiencing homelessness being a big focus, and some wins there. Let's talk about, in this first 3 years, maybe some challenges that we still might have today, and then we'll jump into how we maybe can solve those moving forward.
Yeah, I think the reality is, that community-based organizations, this is a whole new system for them. They were often used to like a grant operational model.
Yeah.
And so this is now more of a system, a contracting. So, it really took time for community-based organizations to increase their capacity. And I know there was a lot of investment in the capacity to, be a part of that system of care. And so, I think building those muscles has been a challenge. And we probably needed more integration, and you'll see, as we're moving forward, more of a hub model or, an integrator roles, because we just realized that this can't be done in isolation. And so I think those have been, some of the biggest challenges. It's always, as you get older, you get less patient if you want things implemented quicker. But I think we have to remember that we're changing systems. So I think the time that it takes, the trust building that it takes, and the tables, we need to set those tables in order for people to work together in new ways. And so I don't think, that's why I think the collaboratives are so important, because they are that community-wide gathering table for people to come together that have not worked together in the past.
Yeah, no, that's really good. And I've seen that myself with the CBOs, great organizations, but I've learned a lot about their funding from the past and all that effort. Every year they got to apply for grants. And so they're excited to have a new funding source. But like you said, it is a challenge as they learn about claims and change their internal systems and get new software and rethink things.
Exactly. Yeah. And I think, just let me add one other thing. I think the workforce, not only just the workforce shortage in this space, because this isn't, a lot of our team has been doing this for years. There wasn't necessarily a funding model to do it. And so a lot of people, in terms of a competent, qualified workforce, that hasn't been necessarily as available as we would like it. And also resiliency, just really helping people. This is some challenging work. So it's helping people with the resiliency to know that you're not going to fix and change someone in 7 days.
Well said.
This is really, a marathon, not a sprint. And, we really need a workforce that understands and that can partner with different sectors of the community, because it's not one entity that can, solve some of our neighbors' problems. It needs to be a collaborative effort.
Yeah, really well said on the workforce. And I think one of the things you're alluding to, and folks, we've done another episode on this, a couple episodes, is the community health worker workforce that has that lived experience as potentially a requirement for the job, so they can connect with the community, speak the same language, have the same background. So really good point on the workforce. Dora, wanted to shift into, so we kind of talked about the challenges, where we are with the workforce. So obviously moving into 2025, we have the CHW initiative. I wanted to give a quick shout out to Inland Empire Health Plan as a great plan that's invested quite a bit of time, effort, and resources into building up certified. I don't know, is the right term certified? I don't even know.
Community health workers, they're So.
Yeah, but once they become official, because so California is in the process of trying to figure out what is license. Are they certified? Do you know, Dora, off the top of your head, what once they pass and become official, is there a license? Is there a certification? Is that still in development?
I know that there's a lot of debate around that, Gavin, because it's really, it was really supposed to be someone with lived experience. So, how do you, but I think, some people call them, certified or licensed community health workers. So they're looking at getting some standardization around that. But yes, shout out to IHP for really investing in the development of our community health workers. But I think what's important about that is they're trusted community messengers. And so that's really an important part of that care team, is that trust.
Definitely. Very good. So moving into 2025, obviously we gave the IEHP shout out, and that's one way, that the community and here in California, different entities are building up a workforce to help overcome some of these challenges, such as change someone in 7 days that you just mentioned, Dora. My background, I come from the home care industry here in California, which historically, if you were not on IHSS or on Medi-Cal, you had to pay out of pocket. Mm-hmm. And so that was a pretty narrow population, and they often had a lot of family support. and people that can influence them. But Medi-Cal is a whole new world. So I've learned a lot. I'm still learning a lot. And I selfishly do these podcasts for myself to learn,
We're
so I
all
can.
learning. We're all
Yeah.
learning, Gavin. I think that's an important caveat.
Yeah. So tell us more about moving into 2025. Like what do you see happening to continue momentum where things are working or to overcome some of the challenges that you've seen?
Yes. So I think moving into 2025, I think really looking at moving from that siloed approach, to coordinating structures. That has to happen so that we're highlighting the vision of what it looks like to work together. We don't need to be, not one person can solve this, but it's a systems approach. I think we're going to really have to look at a focus on system sustainability. How do we sustain this? Because remember, it's not a grant program. This is a system transformation. And so how are we looking at blending and braiding and really looking at having this as a core part of community? And then, really, I think looking at navigation centers or what we call integrator roles. Because that's, we're going to have people that can speak multiple languages. I mean, remember, you have managed care plans working with the homeless response team, working with the justice involved teams. We've all spoke different languages. And so I think it's really coming together with a more coordinated approach. I think you're going to see a lot of community hubs emerging, and whether that's locally or topically based. I think we're really going to have to look at developing leadership and having local leaders own this, and that's why I say we're not leading it. We're facilitating the leadership in the community so that it belongs. Because just my fun fact was about when you build community. And when you build a connected community, it's really hard to break that or undo that.
Yeah.
Go ahead.
Oh, sorry. Go ahead.
No, that's okay. I can go on and on about what's happening in 2025. Yeah, go ahead.
So if you don't know the answer to this, completely fine, and don't mean to put you on the spot. I thought there's at least one county who is creating, even though they're not the plan getting the money from the state, the county was still creating like a CalAIM coordinator role.
Yes, I do know. We've actually helped support that. Tulare. So Tulare in the King's Tulare Homeless Alliance. So, I'll give Iris a shout out. She has been an amazing integrator and really been on top of things, doing process improvement and being that integrator, doing active outreach to populations that need the services. And it's been a wildly successful model. We're actually, go ahead.
Oh, so to clarify, Iris, whoever you are, great job. It sounds like. Is she employed by the county? Is she volunteering for the county? Can you tell us? I'm just curious, how that works.
Yeah, so she is actually employed by the King's Tulare Homeless Alliance. So this is the continuum of care. So it's the homeless response system.
So it is, that's awesome.
But I know, a lot of some of the initial funding came from a collaboration with the payers. So Anthem and HealthNet, coming together to really help support that. And so that's, I think, if you look at one of the amazing things that has surprised me, working in healthcare for the past 35 years, is the partnerships with the payers in our delivery system.
Yeah. So you talked about funding. I wasn't planning to ask about this today. I know that, these collaboratives are often called, or formally called, I guess, path collaboratives. In some cases, I think they started as roundtables, CalAIM roundtables, kind of shifted to path collaboratives. Is there still, for let's say folks are listening in today and they're new to this world, or they're not for profit and they're looking, to be able to scale, is there still funding opportunities anymore, or are those pretty much run out?
Well, with what we call, there's always going to be some funding opportunities through contracting. Some of the managed care plans do have incentive payment programs, but the state has a funding stream called path-sited capacity infrastructure. Oh,
Don't worry about the acronym.
yeah, well, because I think it's important. I want to say technology, but it's not technology, expansion and development. And so it's the past cited dollars from the state. There's one more round. It opens, the application opens on January 6th and closes the first week of March.
Okay.
And this is really, in a sense, a capacity development opportunity for either contracted enhanced care management providers or contracted community support providers. So these are the new providers that have been contracted through CalAIM.
Okay, that's great news to still have that opportunity with the PATH initiative.
Yes.
So 2025 still funding. We've talked about a little bit about systems of care, the collaboration. You talked about the hub models, potentially having some momentum. What about success, right? Like, how will the state, how will the facilitators like you all, how will we know we're having success? How will that be measured?
That is the best question, right? And I want to remind us of why CalAIM was rolled out into all the counties, is because the success from the whole person care and health homes program was so profound that they said, let's open this up. So it was really looking at developing an infrastructure, increasing care coordination, increasing health outcomes, and helping to help with cost. So, that CalAIM was really designed to make sure that people were getting the right care in the right place at the right time. And we weren't using we didn't have inefficient uses of resources for services. I often say I've worked in a hospital the majority of my career, and, we had a clinical toolbox. And when people showed up to the emergency department, it wasn't always a clinical manifestation, and so that was the toolbox that we had. So success is really about helping to get people in the right care at the right time at the right place, especially those that are suffering the most and that have a lot of utilization and are often going into the emergency departments without the ability to solve some of their challenges. So, looking at that, how are we building that infrastructure so that emergency rooms and hospitals or, homeless response teams can know where the resources are, ensuring that people know. One thing that has really surprised us is that most communities don't know about existing resources or new ones. So, making sure that we've improved what we call market awareness and ensuring that people know what resources are available to help serve that client or that community member, and that there's not someone trying to, solve it in isolation, but really building that better care. And ultimately, the reality is having better health outcomes, getting people housed, getting those that are experiencing serious mental illness into the appropriate care, those with substance use disorders, getting the care they need, looking at the birth equity population and ensuring that, we're providing the right care for those that are experiencing the worst health outcomes. So, that's how we're going to look at success. And regardless of what happens, Gavin, somebody has to take care of this in a community. And so that's why we really push the systems of care, because it's going to be pushed from one person to the next. And that's what we've seen a lot in healthcare. It's been, a lot of, whether it's cost shifting or blame shifting or, so at what point can we just say, and I'm proud, I'm a fifth generation Californian. So, it's like, California, let's step up to the plate and let's take care of our community and let's do this collectively and let's figure it out. I believe in the innovation and the determination of our communities if they really believe that they can do it. So that's going to be success.
Got it. So I think the takeaway for me is the word community. I think that's probably the most used word in the last 20 or so minutes that you've shared positively and as part of the solution. It reminds me of, most of the folks that are familiar with the CalAIM initiative that are listening in or watching. You guys are probably familiar with enhanced care management, as Dora mentioned, and then community supports. Those are often the two biggest types of services that people think of even though CalAIM is bigger than that. But CS or community supports, right? And you talked about outcomes, and in lieu of services was the phrase initially rolled out with the CalAIM initiative as community support. So in lieu of hospitalizations, skilled nursing stays, ED visits, right? In lieu of that, what can we do in the community to keep people healthy and in the community, or at home, if you will? And obviously, and that should generally be lower cost.
Absolutely. I know. I mean, I have an 83-year-old mother who I'm taking care of, and to put her in a home or have, the care that she needs, it's expensive.
Oh yeah.
And we're doing everything we can to keep her at home and provide those services. And, it's almost cost prohibitive for, to be in nursing facilities and other, assisted living for some people. So this is a much more cost-effective way of keeping people in their homes and getting them the care where they need. So, but that's a lot of savings.
Yes. Well, Dora, you've always been a great resource for me. And again, you've turned this episode around pretty quickly. So thank you so much. I prepared some questions. I think I covered all of them, but I wanted to give you the opportunity. If there's anything else about the work you guys are doing at HC², whether recapping what you've done so far or moving forward, that you have the opportunity. So please continue if there's anything else you'd like to share.
Yeah, well, thank you, Gavin. It really is a privilege to be able to speak about this work, because I think it's so important. And I think that, we need to really look at this as a long-term strategy for our communities. And so at HC², we'll be working with our local leaders, our managed care plans, the Department of Healthcare Services, in really helping to continue to build these systems of care and ensure that, all the right individuals and organizations in the community are working together and working on this. Also looking at some of the additional funding. When we talk about CalAIM, we just talked about enhanced care management community supports. There was a lot of other investments that were made into the transformation. And so I think connecting a lot of dots and ensuring that there's a lot of, integrative strategies and really sharing the lessons and the success stories of what's happened in California when people collaborate well. That's really going to be a focus, because I think the country needs to learn. We don't need to have every state, reinvent the wheel, or there obviously has to be authentic community learning, but there are some basic standards and foundations that we can share that would accelerate other states that are dealing with the same issues we are in California. We're just amplified. We have more people. We're a country in itself. Yeah. And so I think just moving this work forward and improving the lives of the neighbors that we live with. So that's our goal, and we look forward to doing that into not only the next 2 years, but decades to come.
Awesome, Dora. Well, again, I appreciate you having you on the show. If folks want to connect with HC², I always forget how to put the little 2 up top when I'm typing. So when I reached out to you and Christine to get this organized, I forgot. I didn't Google it. I was too lazy. I typed it wrong. But can you remind us, how do we make that 2 show up in the right spot for HC²?
Yeah, well, you can just do HC, the number 2, strategies.com. But there's the subscript, Gavin, if you want to do it right. But it's really just the number 2. So HC2strategies.com. And we're just thrilled to be partnering with you as well, Gavin, and all the other amazing providers around the state leaning in to this amazing work.
Awesome. Well, Dora, thanks again for being a guest. Again, thank you to Christine for setting this up, and look forward to seeing you at the next collaborative. Happy New Year, Dora.
Thank you. Same to you, Gavin. Take care.
Thanks, everyone, for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.